Well, doctors make so many mistakes. You really, really, really have to take care of yourself. It's kind of like, why is there Home Depot? Why is there Lowe's? Why is there AutoZone? Why is there Pep Boys, right? And so that's because people begin to do things themselves because somehow the dealerships don't do a very good job, or they purposely don't do a good job so they can make more money, or they milk your insurance company or whatever. So what I want you to do is get a hold of that book, Let's Play Doctor, and really look hard for the new book coming out here, Epigenetics. What I want you to do is begin to do your own medical health screening. You can do that once a month, or once every 3 months, or once every 6 months. Do it yourself. And it's amazing what you can do. You can actually go into a pharmacy without a prescription, get the same test strips your doctor would use for a urinalysis in his office, or a blood test in his office for diabetes or A1C hemoglobin, blood sugar, blood cholesterol, that kind of stuff. You can also get a test now called an occult blood test. It replaces a colonoscopic exam. You do it yourself. It costs you about $5. There is a more sophisticated one called a FIT test, fecal immunochemical test. It's called FIT. And I don't know the price of it, but it's probably going to be somewhere around $25 or $50, and replaces the colonoscopic exams, whereas the occult blood one is only like $5, and there's no risk of you puncturing your intestine. It's very accurate. And if you see some blood in your bowel movement on these tests, you're going to go in and get a high-resolution ultrasound. No radiation, no risk of puncturing your intestines, and you're in control all the way. You can diagnose your own self when it comes to diabetes. You can diagnose yourself when it comes to blood cholesterol levels. I'm worried about low cholesterol levels, not high cholesterol levels. And then, of course, you can do your own urinalysis. You can tell if you have sugar or blood or infection or mucus or pH or sugar or whatever. You can detect all that protein. You can detect all that yourself with a single test strip called a multi-stick. Costs like $1.50 each. This is not expensive. Your doctor's going to charge you $800 for the same test you'll do for less than $5. So I urge you to begin to do these things yourself. And why wait until you get full-blown illness? You know, you get prediabetes. You get a little bit of protein in your urine. You want to know why? Well, these tests will tell you. You get a hold of that book, Let's Play Doctor. There's a whole chapter on a home laboratory. A lot of people ask me about parasites. They say, well, have you had a parasite exam? No, I just feel like I have parasites. Well, you can do your own stool examination to see if there's wormy-like things in there, or one-celled parasites. You can do your own blood test to see if there's wormy-like thing or one-cell parasites in your blood or your urine or your stool, your bowel movement. And it's very simple stuff. I mean, even a third grader can do these tests. It's kind of like a Mr. Wizard thing. And get a hold of that book, Let's Play Doctor, and you will just be amazed. You will be amazed at things you could do yourself at home. You can do your own blood pressure. You can do your own pulse. You can do your own allergy test. That's right. Your own allergy test, called the pulse test, is very accurate. Very accurate. Doctors hate it because it's free. You can do it yourself, and you can tell if you're allergic to any food, any drink, any herb or anything. You can do it all yourself, and it's free to do the test. That's right. What you do, of course, you wake up in the morning. Let's say you're going to test cow's milk. And you wake up in the morning, you take your pulse. Let's say your resting pulse is, say, 70. And so you record that. Okay, my resting pulse right now, I'm sitting at the kitchen table watching TV or listening to the radio, listening to music, and I put down starting test 70. Then you drink a glass of milk. Then a half hour after you drink your glass of milk, you take another pulse. Let's say your pulse is 72. That's fine. And then a half hour later, you take your pulse again. Now your pulse is 85. It's gone up 15 points. You're allergic to that milk. It might go up 3 or 4. You're not allergic to the milk. And you know you're allergic to milk. Now, the next day, you can do another test. You could test coffee. You could test butter. You could test peanut butter. You could test, peanuts. You could test anything you want, tomatoes. You can do it all yourself. It's called the pulse test. And it was invented by a very, very highly ranked allergist, but the doctors hated him. He was an MD, but they hated him because he showed the patients how to do their own testing. And most doctors who are allergists make 90% of their money from testing, right? So these are things you can do. Again, get a hold of that book, Let's Play Doctor. Read that entire chapter on home laboratory. You'll be just amazed what you can do. Get a hold of the book, Epigenetics, and see why you want to supplement. So you can avoid birth defects. You can avoid every birth defect you can name, and 10 times that many you can't. Also, if you have diseases, most of the diseases that you have, are either you can manage them better with nutrition, or you can actually reverse them with nutrition. So again, here's the book Let's Play Doctor and the book Epigenetics Going to Steer You in the Right Direction. If you're a baby boomer, you want to get a hold of that book, God Bless America. It's specifically directed to baby boomer type diseases, ones that are physician-caused diseases, such as Alzheimer's disease, erectile dysfunction, low T, menopause. These are all physician-caused diseases. Low adrenal glands, right? Adrenal exhaustion. These are all physician-caused diseases. Why? Because they've given you a lot of misinformation when it came to cholesterol. Cholesterol is an essential nutrient. They should not have told you to restrict your dietary cholesterol. They should have told you. Not to use statin drugs. But instead, they jumped on the statin drug bandwagon so they could make some extra money. You want to take care of yourself and not be one of those 15,000 seniors that are killed every month by doctors who do screening tests in hospitals. 15,000 a month they kill. It's 180,000 a year just screening tests in hospitals. Medical doctors must not like seniors. Okay, you know where to go. Dead doctors don't lie and Youngevity. We'll be back with more Truth, Justice, and the Youngevity Way after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk a bit about food today, as I've got a couple of stories on food. And the first one actually is something you've talked about a bit, and that is the hidden risk of processed meats. Now, what they're talking about here is a study out of Sweden from the Karolinska Institute, where they found that a mere 1.8 ounces of processed meat a day, that would be 2 slices of bacon or 1 sausage, can increase your risk of pancreatic cancer by 19%. And this is from Fox's Dr. Manny Alvarez. He writes, I found that the research was extremely solid. The overall analysis conclusively points to the fact that all of these processed, cured, and smoked meats can be quite toxic. And he poses the question, is pancreatic cancer actually on the rise? And he goes on to say, pancreatic cancer, at least the answer appears to be yes. A 2006 study that was published in the Clinical Cancer Research Journal concluded that the increased risk was real, and that the exposure to carcinogens was one of the main culprits behind the rise. They say the main problem is with pancreatic cancer, it's difficult to diagnose. Doctors don't have any unique test for pancreatic cancer. And second, when a patient does actually exhibit symptoms such as jaundice or abdominal pain and weight loss, they're typically nonspecific, and it easily goes undetected until the cancer has reached an advanced stage. So because pancreatic cancer is so difficult to detect early, he thinks it's important we take a look at our population today and the rates of obesity and realize that good nutrition is the key to preventing cancer. I think that deserves another one of these. Because you've been talking about this for years, stay away from these processed meats with all the nitrates and nitrites, and, now we find another good reason not to be eating these things.
Oh, absolutely. And, of course, how you cook meat that's acceptable. In addition to getting rid of the processed meats with nitrates and nitrites, deli slices, sandwich meats, that kind of stuff, even if you have a good roast beef or a pork chop or a hamburger meat, and you cook it very well done, you're actually burning the fat, and, the outside is almost charcoal. A lot of people like that, particularly pregnant women love the taste of that charcoal because the embryo is stealing nutrients from her and she's got cravings. The charcoalized animal fat tastes very good to them, and it increases your risk of breast cancer by 462%. That's according to a big study by the University of South Carolina, came out in 1998. Eating meat cooked very well done compared with medium rare, it increases your risk by 462%. You cook it medium rare, it reduces your risk by 462%. So ladies, do not cook your meat well done. Do not eat processed meat. You also want to supplement with extra selenium. You want to get up around 300 to 400 micrograms a day. Our ultimate selenium has 100 micrograms per capsule, so you would take 3 or 4 of those a day, and that reduced the risk of breast cancer by 82%. And so these are things you can consciously do. Don't be waiting and hoping and praying that the doctors are going to come up with a treatment or the government is going to come up with a treatment. Just don't get the cancer. But you're going to have to be very proactive and very obsessive about avoiding the bad things. And this is Doug. I can't compliment you enough for coming up with all these wonderful things that are scattered around out there and getting them onto our listeners.
Yeah, and another thing that I found with a lot of these processed meats is that some of them have fillers in them that can contain wheat or cornstarch, and if you're one of these people that have gluten intolerances, you can have a problem with eating these deli meats, so yet another reason to stay away from them.
There you go. There's a twofer and a double whammy. Thank you so much, Doug. Well, stick with us, folks. We're going to be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Well, let's head to California. And Maria, you're on with Dr. Wallach.
Hello, Maria. You're on the air.
Hi, Dr. Wallach.
Hi. How can I help you?
I have a question, and also my daughter has been on your healthy bone and joint class for 22 days because of some growing pains. And she hasn't had any pain like before. Now it's only once in a while and very little.
Okay, so she's seeing improvement very quickly.
Yes.
Very good. How old is she?
She's 11.
Okay, well, congratulations. Yep. Little kids need nutrients, don't they? So you've solved her problem. So she's got to be a happy little girl.
Oh, yes, she is.
Thank you for the feedback.
I keep giving it to her for how long do I keep giving it to her?
Okay, how can I help you today?
Okay, for dry mouth.
Okay. This can be called Sjogren's disease, dry mouth, dry eye. And this is kind of a variation on Bell's palsy, which is a problem with the seventh cranial nerve, the facial nerve, which comes out from behind your ear, from the brain through the skull, behind your ear, along the side of your face. And there are branches of it that go into your eyelids and control the tear glands. And then there's branches of it that goes into your mouth and deals with saliva, salivary glands. And when that is being squeezed, when that nerve, the facial nerve, the seventh cranial nerve is being squeezed, you get dry eyes, dry mouth, and you can have droopy muscles on one side of your face. It looks like you've had a stroke, but really it's called Bell's palsy. It's reversible and certainly preventable. It's caused by osteoporosis of the skull. And this can happen at any age. This can happen in little kids. This can happen in pregnant women because the baby's stealing nutrients from her faster than she's taking them in. This can happen to people in their 40s, 50s, 60s, 70s. Very typical in people who have osteoporosis of the skull. And this shows up also as periodontal disease, loose teeth, receding gums, periodontal disease. Let's see here. Anything to do with the gum line, okay, pyorrhea, gingivitis, that kind of stuff. So this is a healthy bone and joint pack, 1 per 100 pounds of body weight, healthy bone and joint pack. And stay away from carbonated drinks because it does neutralize stomach acid, reduces the ability to absorb minerals. And put the CM cream that comes with that down in the ear with a Q-tip like you're trying to get wax out of the ear. And oftentimes you get immediate relief, which might last for 3 to 4 hours. It takes 3 to 4 or 5 months to get rid of the problem. We'll be back after these messages.
Let's head to Atlanta, Georgia. And Lola, you're on with Dr. Wallach.
Hello, Lola. You're on the air.
Hi, doctor. I just wanted to find out what would you recommend for depression, asthma, and high blood cholesterol?
Okay, is that the same person?
No, 3 different people.
Okay, when you say high blood cholesterol, what is the number?
I don't have it at the top of my head right now. But
okay, to me, high that you want to be concerned about would be 300. Normal cholesterol is 220 to 270. I'd be more worried about low cholesterol. People get cholesterol naturally without medicine, without medication. Their cholesterols are like 200, 190, 120, 90, 60. They're in big trouble because they have a terrible gluten intolerance. Their intestines have lost the ability to absorb nutrients. And cholesterol is a big, clumsy molecule, very difficult to absorb under ideal circumstances, let alone when you have gluten intolerant problems. And so I'm more worried about low cholesterol than I am high cholesterol. High cholesterol just means you're sexy because cholesterol makes up 95% of estrogen, progesterone, and testosterone and adrenal hormones, all steroid hormones. So you want lots of cholesterol. So when people say they have high cholesterol, the medical doctors have got them brainwashed, okay? Asthma is caused by omega-3 essential fatty acid deficiency, usually secondary to a gluten intolerance, because, again, The omega-3s are very difficult to absorb under ideal circumstances, but when you have gluten damage to your intestines, it's very difficult to absorb omega-3s, or there's a ratio problem between omega-3s, 6s, and 9s, and that is the cause of asthma. It goes away very quickly, usually in a couple of weeks when you get off of gluten and you take the 90 essential nutrients. Depression can be caused by nutrient deficiencies, many of them, and so what I like people to do when they have depression, stay away from sugar, which contributes to depression. Stay away from sugar in any way, shape, or form. Agave syrup, maple syrup, corn syrup, honey, molasses, table sugar, soft drinks, juices, dried fruit, fresh fruit. You got to stay away from all that. Anything with sugar, natural or processed, doesn't matter. Sugar is sugar. Got to get rid of it when you have depression or any brain diseases or emotional diseases. Manic depression, bipolar, schizophrenia, all that kind of stuff. And I'd have them take one of the healthy heart and brain packs per 100 pounds of body weight per month. I would also throw in 3 of the D-stress capsules, capital D like David - stress, 3 of those twice a day per 100 pounds of body weight. And call me every couple of weeks. Do not cold turkey off of any medication for depression or bipolar disease or schizophrenia. What you want to do is go tell the doctor who wrote the prescription, hey, I'm feeling pretty good, and I'm getting bored with taking these medications now, and I want to see if you can't cut them or have me drop them or whatever. Let the doctor who wrote the prescriptions for any emotional disease, let them reduce them or get you off of them. But they will when they are convinced you're feeling better. Well, stick with us. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages.
Let's head back to California. And Shannon, you're on with Dr. Wallach.
Oh, Shannon, you're on the air.
Hello, Dr. Wallach.
Hi, how can we help you?
Well, I have a 10-pound cat that has conjunctivitis in both eyes with a yellow discharge, and all his behaviors are normal. We took him to the vet, and he nearly died from the treatment.
What was the treatment?
He gave him an injection of steroids, antibiotics, and another thing I can't describe, and the cat almost barely survived it.
Mm-hmm. Okay, well, here's what I would do. Is the cat still eating?
Say again?
Is the cat still eating?
Yes, everything is normal.
Okay. Well, what I would do then is get our Arthrodex, which is a sort of mega supplement for dogs and cats and other flesh-eating creatures. And I'd go ahead and, what does this cat weigh, you think?
10 pounds.
10 pounds, okay. I'd give it a half a scoop of the Arthrodex in its food every day. I'd also give it 1 of the EFA Pluses. It's a fish oil source of omega-3s. Per day, you could either puncture it and squirt it in the food or put it down the cat's throat and rub its little throat and it'll swallow it. So again, that's a half a scoop of the Arthrodex in its food every day and 1 EFA Pluses each day. This can give it all 90 essential nutrients appropriate for that cat and the body weight. And then I would also get our colloidal silver. Put 1 dropper full in a couple ounces of water in a little spray bottle and hold the cat and, hold his face under the jaw and then hold that spray bottle with the 1 dropper full of the Envision colloidal silver in a couple ounces of water, and you close your eyes and you spray it at yourself and the cat and leave the drops fall on the cat's face. You can even take some of that mix, put it on a cotton ball, and wipe the cat's eyes with it, get the mucus and discharge out of the corners of its eyes and so forth. A lot of times these chronic conjunctivitis, which is the inflammation of the lining of the eye socket underneath the eyelid, is due to a vitamin A deficiency. Then you get secondary infections and all this kind of stuff. Wouldn't hurt to even consider changing the cat food, especially if the cat food has gluten in it. Read the label. If there's any grain in that cat food, switch cat foods. Give us a call every couple of weeks if you would. Let us know how cat is doing. All right, Doug, let's go to callers.
Let's head to Salem, Oregon. And Cherie, you're on with Dr. Wallach.
Hello, Cherie, you're on the air.
Hello, it's Cherise from Dr. Wallach.
Cherise, okay.
Talking to you. Thank you. God bless you. I am 54 years old. I have extreme fatigue and depression. My mother died of cancer at 48. My father has dementia. His string of family members have had severe arthritis. I just found out I'm gluten intolerant, and I have severe mood swings, but my main concern right now is that I haven't drank milk for years because I was told I'm allergic to dairy. And if I just bend over or pick something up or turn, I hear all this crackling like I just broke a bunch of little bones in my back, and then I'm debilitated for a while.
Okay, well, how much do you weigh, Sharice?
110, 7.
Okay, so you're a tiny woman, and how tall are you?
5'4".
Okay, yeah, so you're slim. 5'4", 110 pounds, you're slim. And so what I would do is this. You got to stay away from all sugar, natural and processed. This includes fruit juices. This includes vegetable juices. You don't want to be doing any juicing yourself. No agave syrup, maple syrup, corn syrup, no honey, no molasses, no table sugar, no dried fruit, no fresh fruit, no fruit juices. No soft drinks, even organic ones from a health food store, no soft drinks. No jellies, anything with sugar in it you got to stay away from. Then I'd be eating things like eggs. I would eat eggs for breakfast and a baked sweet potato, say with some butter and cinnamon, sliced tomatoes. It's a great breakfast. And then for lunches, I would have like salads, no salad dressings, there's oils, no fried foods, no processed meats with nitrates, nitrites, no oils, no gluten, no wheat, brother. I noticed you know that. You have a gluten intolerance. I'd get a hold of that CD called Serial Killers. Goes into all the hidden places you're going to find unmarked gluten sources. You got to be aware that they're available, and you got to avoid them. That's Serial Killer is the CD. And then for the depression, in addition to taking one healthy blood sugar pack per month, divide it in half, take a half a dose of everything at breakfast and dinner, I'd also get the D-stress capsules, capital D like David -stress. Take 2 of those twice a day for your body weight. That would be 1 bottle a month. And you can be, I'd also, let's see here, in that one healthy bone and joint pack, you're going to get the glucogel. Wouldn't hurt to get a second bottle of glucogel, so you can take 15 of those a day. That's going to get rid of the crunchy, grindy noises in your neck and your back and your knees and hips and all that kind of stuff. And let's see here. You can be happy to know that dementia is not genetic in any way, shape, or form. Usually gluten intolerance comes from your mother's side. It's not genetically transmitted, so it's not unusual for both members of the couple, the dad and the mom, both to have gluten intolerance, but the dad got it from his mom. It's not genetic. It's passed on from women through cord blood and breast milk to their babies. Men get it, but they don't pass it on. Women do pass it on. And the fatigue thing, I would say you need to eat protein snacks in between meals. Again, eggs, nuts, but you got to read labels carefully. Even though they say naturally gluten-free, you got to read the allergy information on the back of the label. It'll often say, even though in bold letters in the front they say gluten-free, you go look at the allergy information. It says these nuts have been processed or packaged on equipment that also processes wheat products. So you got to avoid that because there's a lot of wheat dust in there. Another thing you can do, of course, for the fatigue, we do have energy drinks, very, very good, healthy energy drinks. One of my favorites, of course, that's gluten-free is our Rebound. It's a sports drink that has 100 nutrients in it, including all 77 minerals, including the 60 essential minerals. And then there's also ACT, great energy drinks. And these are things that, you're just not going to get crazy with. They don't make you crazy as far as jittery and all that kind of stuff, but they will deal with fatigue. And again, oftentimes you have fatigue when you have gluten intolerance because you just can't absorb nutrients. So the tighter you are on gluten avoidance, the better off you are. And that includes everybody in your household. If there's any man in the house, a husband, a boyfriend, kids, mother-in-law, mom, sisters, dog, cat, fish, bird, everything in the household has got to be gluten-free, and that will make sure you're gluten-free because cross-contamination, even though you're doing a good job, there will be cross-contamination in the laundry, the bed, the food preparation surface, the couch where everybody's watching TV, and so it's imperative that everybody in the household has got to be simpatico with people who live in the house who do have a gluten intolerance, so there cannot be any gluten in the house. If they do like to eat gluten outside the house, I'd put a shower in the garage, put separate clothes in the garage. They come in, they got to dump their gluten-contaminated clothes, wash them in a different washer and dryer, take their shower, get dressed in non-gluten clothes before they come in the house. We'll be back after these messages. back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 for Life Crusade. And Doug, let's go to callers.
Well, let's head to Salinas, California. And Jerry, you're on with Dr. Wallach.
Jerry, you're on the air.
Hi, Doctor.
Yes, sir. How can we help you?
Well, I'd like to feel better, lose weight, and become my own boss.
Okay, very good. We can help with all that. Well, how much you weigh?
255 pounds.
And how tall are you, sir?
6 foot.
Okay, well, we want to lose anywhere from 55 to, say, 70 pounds, depending on how your frame is. And we can do that. And be your own boss. That's very, very easy. You can contact your Longevity associate. If you don't have one around there, what you do is you just hang on when we're done. And Doug will direct you in the right direction according to where you live and so on. Particularly California is easy for him to help you out. At any rate, 255 pounds. Do you have any other health problems, any arthritis or diabetes or high blood pressure?
My blood pressure's high. I don't have the number, but
okay.
I'll
take your word for it. Okay. Well, what I would do then is 255, kind of a minimum approach would be 2 healthy heart and brain packs per month. 2 healthy heart and brain packs per month. That'll allow you to have 3 selenium at breakfast and dinner, 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, 3 of the EFAs at breakfast and dinner, and then I'd get 2 bottles of the Ultimate Daily Tablets, take 9 a day, 3 at breakfast, 3 at lunch, 3 at dinner. That will support and promote healthy blood pressure. It will support and promote healthy blood flow through obstructed arteries. And then to lose that 60 pounds or so, what I would do is get a hold of 2 bottles of ASAP per month. I would go ahead and take a dropper full under your tongue 30 minutes before each meal, and then 15 minutes later, 15 minutes before each meal, take a second dropper full under your tongue 15 minutes before each meal. So you're going to take 2 droppers full before each meal, 1 dropper full 30 minutes before each meal, and 1 dropper full 15 minutes before each meal. And you'll begin to lose weight within 2 or 3 days. You're going to lose anywhere from a half a pound to 2 pounds a day. And the magic here is, Jerry, you will not gain the weight back as long as you stay on the healthy heart and brain pack per 100 pounds of body weight. And I'm kind of going light on you. Optimally, you'd want to take 3, but I'd rather have you take the 2 bottles of the ASAP because the cost will be about the same as another healthy heart and brain pack or the 2 ASAP bottles. And so this is going to kind of kill 2 birds with 1 stone here. And again, to be your own, have you ever owned your own business before, Jerry?
No, sir.
Okay, well, I would get a hold of that book, Wall Street for Kids. It'll teach you how to build a business plan. It'll teach you how to be profitable and work out of your own home. Do not rent any space, any place. You run out of your own home. And you get all kinds of great tax deductions when you have a home office. They're quite legitimate based on actual square footage under your roof. You get to deduct your home office. You get to deduct that same percentage that you're able to take off your mortgage or your rental. You can take that same percentage. Let's say it's 10%. You can take that same 10% off your utility bill. You can actually deduct the same 10% when it comes to your homeowners or renters insurance. And then anything you do with the longevity business, anything, giving out samples, running booths for trade shows, travel, going to meetings, any kind of expenses you have, your one-time $10 fee if you want to come in at the beginning level. If you want to come in at the higher level, get stock options and bigger car bonuses and so forth, you come in at what we call the Mega CEO. You can come in, like I say, at the $10 level. Most people do. That's where you start. But if you really want to get a jump start, you get 3 healthy start packs. You get a lot of samples. I think there's 4 or 5 or 6 different boxes of samples. And you get all the information on how to start your own business. It's called the Mega CEO Pack. I think it's $4.99. So you get over $500. I think you get like $700 worth of stuff for $4.99. And you're in business right away. If you want to come in at the $10 level, we still love you. And I'd say probably 80% of the people who start a longevity business do it at the $10 level. So anybody can get in and be their own boss and take control of their own life. So welcome aboard, Jerry. You're joining the longevity family. We love you. We'll walk you through your health interests, and we'll walk you through your business. There's no cost to training. We train you for nothing. Well, thank you so much, everybody. A great questions and testimonies today. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs, and God bless America.